Okay, and you can begin.
Well, hello and good evening. My name is Kirsten Sinema, and I am honored to serve as your representative in Congress. Right now, you are listening to a live telephone town hall. This is an exciting and convenient way for us to keep in touch. During this telephone town hall, you can ask us your questions, so I hope you'll stay on and participate in our event tonight. As a school social worker for 10 years, I learned to put the families I serve first. And now, as your new representative in Congress, I'm working to put the people of Congressional District 9 first. One of the ways I'm doing that is by fighting for our veterans and their families. Tonight, I want to have a conversation about the issues affecting the Phoenix VA and what I'm doing to help solve those problems there. You see, my older brother is a retired Marine, and my younger brother is on active duty as a gunner's mate in the U.S. Navy. I come from a family of military service, and I fought for veterans since I was first elected to the Arizona legislature way back in 2004. Like many of you, I was stunned by the revelations of misconduct and dishonesty at the Phoenix VA. My first priority has been ensuring that our veterans get the health care that they've earned and deserve. Unfortunately, the current reform of the VA came too late for one very special veteran in our district. Daniel Somers was in the Army, and he served 2 tours in Iraq. He served in a classified capacity as an interrogator. He came home suffering from post-traumatic stress disorder and with a traumatic brain injury. Daniel struggled with depression, and when he went to the VA for help, he was turned away. In one instance, at the VA emergency room, he was told he could lay on the floor until he felt better and then drive himself home. Daniel sadly took his own life in June of 2013. He left behind a loving wife and his parents, Howard and Jean. The Somers have now made it their mission to reform the VA and ensure that no veteran experiences the delays, inadequate care, and ineffective treatment that Daniel had to endure. With the Somers' help and guidance, I introduced the Veterans Access to Care Act in October of 2013. This legislation allows veterans with classified experiences to get the one-on-one mental health care and counseling they need to be able to discuss their experiences. We didn't wait for Washington to act. We've taken aggressive action here in Phoenix to improve the quality and accessibility of care provided to Arizona veterans and to change the culture at the Phoenix VA. Veterans waiting on secret lists now have appointments. We urge the Phoenix VA to aggressively leverage non-VA doctors and specialists, which they're now doing. We also established a working group of community providers, veteran service organizations, the Phoenix VA, and over 20 veteran service organizations to facilitate community engagement by the VA and to expand care available to veterans. Recently, we co-hosted the Veterans First Clinic, which brought together community providers, the Phoenix VA, and over 20 veteran-serving organizations to help veterans in a whole variety of ways. The Phoenix VA now delivers bi-monthly briefings to the Arizona Congressional Delegation and is improving its transparency with veterans and the public. It's also fixing the scheduling system, hiring more staff, and expanding its physical footprint to provide appropriate services. A week ago, we asked the new VA Secretary to come to Phoenix to see the progress and challenges we face, and he came. Despite this progress, there is significantly more work to be done. Additional mental health providers are required. The physical expansion of the Phoenix VA will be a challenge. Confidence in the system has been shaken, and the morale of the many dedicated and honest and hardworking employees at the facility is low. Phoenix will also experience a significant increase in demand for services as snowbirds return to Arizona in the fall, and we must accelerate the progress we've made if veterans are to receive the care and benefits they've earned. To explore these issues and dive into them more deeply, I'm joined by a very special guest. Colonel Joey Strickland is a 30-year veteran of the U.S. Army who served 2 combat tours in Vietnam. Colonel Strickland served as the director of the Arizona Department of Veterans Services and has received several national honors for his work on behalf of veterans. He's also a personal friend of mine, who I've gotten to know over the years in my term of service in the state legislature and now in Congress. Colonel Strickland is going to share an update on the current situation at the VA from his perspective, and he'll stay on to answer your questions as well. So, Colonel Strickland, thank you so much for joining us, and we're eager to hear an update.
Thank you so much, Congresswoman Sinema. It's a pleasure to be here with you. I believe that we are all familiar with the scandal that started at Ground Zero here at the VA Medical Center in Phoenix, and unfortunately has spread to more than 80 facilities nationwide. For a long time, many of us, including myself, that used the VA knew that record-keeping systems did not accurately reflect the amount of time patients waited for care. Unfortunately, the Inspector General's report confirmed allegations of mismanagement and the manipulation of data related to veterans' wait times. Arizona, 600,000 veterans who use the VA healthcare system deserve much better. And thanks to congressional leaders like Congresswoman Sinema, Arizona veterans who spent months on waiting lists now have their appointments. The VA is hiring more doctors and specialists, and veterans who cannot see a VA doctor within a reasonable amount of time under the recent reform bill urged and passed by Congresswoman Sinema and others will now be able to see a doctor of their choice. And in my opinion, this is the right direction and right way to go. More importantly, this bill allows the VA secretary to fire incompetent or corrupt administrators, and it is hoped that the secretary uses this new authorization. Trust and confidence must be restored, as Congresswoman Sinema just stated, to the VA, and this can only be accomplished through complete transparency. I was in the audience listening to Secretary McDonald when he visited Phoenix at the urging of Congresswoman Sinema. Congresswoman Sinema will also address the issue of bonuses that administrators were receiving, and in many cases should not have been receiving. Arizona is a veteran-friendly state, but like she just stated, there is much work to be done. We need jobs for veterans. We need our veterans to stay and graduate from our colleges and universities, and we need to continue to advocate for our homeless, for our women, and to work with our friends like the Summers to prevent suicides by our veterans. And we need to encourage veterans courts to give our veterans a fair shake. Congresswoman Sinema, my son Josh will be coming home from Afghanistan in 2 weeks. We need to do this for him and for all of our veterans who have served. And I am honored to work with you on these veterans issues.
No, thanks so much, Colonel Strickland. How exciting, 2 weeks until your son comes home.
We can't wait.
Oh, that's going to be a big homecoming party.
He's our youngest and the third of our sons to have served in combat.
That's wonderful. Now, is this his first tour? Or
First tour.
First tour. Wow, that's really impressive. Well, thank him for his service and give him a hug for me when he gets home.
He'll probably come by to see you.
Oh, I can't wait. Well, thank you, everyone who's joined us on the call. So listening to you is my most important responsibility. So now I want to spend some time hearing from you. I want to continue our conversation and answer questions from those of you who are on the line or listen to your comments and feedback. If anyone has a question that you'd like to ask or something you want to share with me, just press 0 at any time. You can also press 0 if you want to connect with a member of my staff, if you have specific questions about, for instance, your early ballot, voter registration, or anything regarding upcoming elections. So if you'd like to talk with us, just press 0. I'm also going to ask a few questions of all of you tonight. One of the ways that I do my job best is to make sure that I'm reflecting the values and opinions of the constituents I serve. So tonight, I'm going to do a couple poll questions myself and ask you what you think. So I want to know if you support the idea of allowing veterans to seek immediate medical care from private providers if their local VA office cannot see them within a 2-week period. If you think that's a good idea, press 1. If you think it's a bad idea for the VA to allow veterans to get care from a private provider if they have to wait more than 2 weeks to see a doctor, press 2 if you think it's a bad idea. If you're not sure or don't know enough to answer the question, press 3. Again, press 1 if you agree, 2 if you disagree, and 3 if you're not sure. And while you're responding, I want to share with you a key provision of the new VA reform law that just went into effect a little over a week ago. The law allows veterans who cannot get appointments with the Phoenix VA in a short period of time to seek and receive care from a local community doctor not affiliated with the VA or a specialist of their choice. I supported this legislation because I think it's an important step to reducing wait times in the short term, while we address the long-term issue of making sure the VA can address veterans' needs. So as those answers are coming in, we'll tally the results and share them with you. In the meantime, if you'd like to ask a question, press 0. It sounds like we've got someone on the line. Rita from Mesa, you are live.
Hi, Kirsten.
Now
How
you're
are
live.
you?
I'm doing great, Rita. How are you?
Very well. I am concerned about the status of the whistleblowers. It seems kind of unjust for them to still be banished from their usual workstations and being able to be around their workmates. And there has been absolutely nothing that I have seen in the media or newspaper, TV, or anything that addresses when they're going to be returned to their normal work status, if they so choose.
Well, Rita, I'm glad you've asked that question. It's thanks to the whistleblowers that we uncovered this scandal at the Phoenix VA, where high-level managers were falsifying records in order to increase their own bonuses, at the same time leaving veterans without the care they've earned and deserved. And as we know, at least 18 veterans died while waiting for care. That's confirmed. There's allegations of more than 40 veterans that may have lost their life while waiting. So the new VA reform legislation that was signed into law about a week and a half ago does provide legal protections for whistleblowers. It prevents managers from reassigning them, from demoting them, or basically banishing them within the building. When I met with the new Secretary McDonald just a week and a half ago, we specifically asked him to address this issue rapidly. There are whistleblowers at our very own Phoenix VA who are working in the basement, unable to access the very veterans that they've dedicated their life to serving and taking care of. One of them is a personal friend of mine. So we're fighting on this issue. I've also co-sponsored additional legislation to protect whistleblowers in particular. And some of this legislation is moving its way through the House right now. If you're interested, Rita, we can share with you the exact legislation that we've worked on. It's all bipartisan legislation that ensures that that individuals who work at a VA anywhere across the country who take the very significant risk of blowing the whistle for unbecoming or inappropriate activity have the ability to get the protections that they need. So we'll share this information with you. If you'd like to stay on the line, we can email you some of this newer information. But the good news is that the legislation that just passed a week and a half ago and was signed into law by the President does provide this support. It's now up to the Secretary, the new Secretary, to actually implement those provisions of the law. And I can promise you this, Rita, we are going to be demanding accountability and transparency from him. In fact, I have a private meeting with him next month in Washington, and I'll make sure to add this to the list, Rita, and we'll get back with you and tell you the results of that meeting. So thank you, Rita, for your concern for our friends who are brave enough to risk their own careers and tell the truth. Before we go to our next question, I want to share the results of our first poll. I asked if you all thought it was appropriate for veterans to get access to private care providers if their local VA can't care for them within 2 weeks. 93% of you said yes. None of you said no. And 7% said you were unsure or undecided. So thank you for this. This helps me know that we're doing the right thing by enforcing this portion of the legislation. For those of you on the line, just press 0 if you'd like to ask another question. Looks like Carol from Chandler is on the line. Carol, you're live.
Yes, I'd like to know, now that you've got somebody in there taking care of the VA and being responsible, are they going to continue follow-up year after year? I mean, it seems like this has been an ongoing thing with the veterans, and it's a sad situation. But I'd like to know if everybody's going to keep on top of it now. Thank you.
Well, Carol, thank you for that question. I can't speak for others, but I can pledge to you this, that I will and my office will, and my Veterans Advisory Committee will continue to stay on top of this. You know, these allegations and these problems at the VA have continued for years, and I'm going to allow Colonel Strickland to talk about his own experiences for a minute. He's got much more experience than I do. But I can promise you this, our office's number one commitment is to taking care of our veterans and our men and women in uniform, and we're going to stay on top of this like white on rice. So we pledge to you that we'll stay on top of it. Colonel Strickland, do you want to talk a little bit about accountability and these continuing problems?
Yes, ma'am. Veteran Carol, that's a very good question, and I can assure you that veteran leaders here in the Valley, and there are a number of us. I'm former director of Veteran Services, also national president of all state directors of Veterans Affairs. I will be bringing up this concern that you just stated at a national conference of all fellow state directors in San Diego next month, and we as a national group will be pressuring the new Secretary McDonnell to ensure that that we don't drop the ball on these questions. It's too important. I have 3 sons, all have served. My youngest one is coming back from Afghanistan in 2 weeks. We understand the importance of these issues, and I can assure you that veteran leaders are not going to let this go. We're going to stay on top of it.
And thank you so much, Carol, for your concern and for identifying a common problem. That historically the VA acknowledges problems and then people lose interest and it doesn't get fixed. And we're going to make sure that doesn't happen here, not on our watch. I'm going to ask folks, if you'd like to ask a question, just press 0 to get in the queue, and we want to try and get to everybody's questions this evening. So press 0 if you have a question. I want to ask you all another question. I want to know if you support the immediate firing of senior executives at the VA who were involved in falsifying records, delaying care for veterans, or misleading Congress on issues affecting veterans' health care. If you believe that those folks should be fired immediately, press yes. If you think those folks should not be fired immediately, press 2 for no. If you're not sure or don't have enough information, press 3 for not sure. Again, if you want those senior executives to be fired immediately, press 1. If you don't want them fired immediately, press 2. And if you're not sure, press 3. While you're entering your poll responses, I'm going to talk to you about another bill that I've introduced this summer. This is a bill called the Bipartisan VA Accountability Act. I introduced this bill with my friend Dan Veneshik from Michigan. Dan is a Republican member of Congress from Michigan whose daughter is serving overseas in active duty today. The bill requires any senior executive at the VA who gets fired for misconduct related to the scandal of bonuses. Our bill requires them to repay their bonus back to the VA for all of the time in which they falsified records or behaved improperly. Last year, the VA paid out nearly $2.8 million in staff bonuses. I don't know about you, but I think that the people who received those bonuses while acting improperly, lying and hurting veterans, they should be held accountable, and we should get that money back to spend on veterans' care. I'm hopeful that this bill gets a hearing when we get back to Congress in September, and Dan and I will keep fighting to get that bill heard. While we're telling the results of that question, it looks like we've got another question on the line. William from Phoenix.
Yeah, I got a comment about your comment about the VA in the 2-week waiting period.
Yes.
I have a question why it takes so long to get an okay from the VA to get to see a doctor. It took me 4 months to go see a urologist.
That's outrageous, William. You know, I just learned this several months ago, that the VA's urologist used to work part-time, and then the gentleman retired. And so for 2.5 years, the VA didn't even have a urologist. And so many veterans like yourself, William, who needed to see a urologist were waiting a month, 2 months, 4 months, even 6 months to see a specialist. That's unacceptable. But the good news is, William, that should never happen again. 2 reasons. 1, we fought hard with the administration to make sure that the VA had the ability to contract with private doctors in the community to get veterans the specialty care, the mental health care, and the primary care they needed. So now, if a veteran comes to the VA and needs to see a urologist, we work with a system called TriWest, and that veteran should get their appointment scheduled within a week and skip to see the doctor in less than a month. And the new VA reform bill that we just passed into law says that if you have to wait more than a month, you can go see any doctor you want in the community who also practices in the Medicare region, which is most doctors. So you don't even need approval anymore. If you've got to wait more than a month, you can go out and see a doctor yourself. Now, I don't think the veteran should have to go make that appointment on his or her own. I think the VA should make that appointment for you. That's their job. So this contract with TriWest should solve that problem. Now, William, if you've still got a problem and you're still waiting to see someone, make sure you stay on the line because we want to try and fix this for you. We can get you an appointment scheduled as quick as you need one. Colonel Strickland, any thoughts about this?
Now, Congresswoman, I think what William was talking about is the problem that our veterans had with having to sit on waiting lists forever and not getting anywhere. I think with the new law that you just described and the short turnaround, I think, William, it's going to improve. I use the VA system. I've experienced some of the things that you're concerned about, but I think it's going to get better with this new law. And if you need some help, please do what Congresswoman Sinema suggested, okay?
Well, and I tell you what, if it doesn't get better with this new law, we're going to be on top of it and make sure it gets better. Thank you all so much for continuing to participate. I want to share the results of the last poll question. I asked you if you supported the immediate firing of senior executives who falsified records, delayed care for veterans, or lied to Congress. 80% of you said yes, fire them immediately. 5% said no, don't fire them immediately. And 15% of you said you were unsure about the issue. I want to thank you for that response. That helps us know how to move forward and how to represent veterans accurately in our district. Remember, if you're on the line and you'd like to ask a question, just press 0 and we'll put you in the queue. It's not a long wait. It looks like we've got Bonnie on the line from Phoenix. And Bonnie, I understand your son served in Afghanistan.
Yes. My question.
Well, we're here to listen.
Pardon me?
We're here to listen.
Oh, thank you. While he was there, his family was having a little difficulty, and we stand behind our family. A lot of times their pride is in the way, and they weren't making it so well. And I said, well, I can understand. You should be getting enough salary. And they go, no, Mom, we don't. So I called the VA, and they said, well, they can get food stamps. And I thought to myself, my son is over there wearing a uniform that says an American. And he's given his life just to help us, maintain our status in society, in the world. And to hand him a book of food stamps would be so demeaning. If it was me, I don't think I would want to be proud that I was American. I know that sounds silly, but have you ever had to get food stamps?
Well, Bonnie, actually, I will tell you, Bonnie, I was on food stamps when I was a kid. My parents got divorced and my dad left. My mom, who didn't get to go to college, was left alone with 3 kids, and we were on food stamps. But I'll tell you this, Bonnie, if we had been on food stamps while my dad was serving overseas, I think my mom would have been quite angry about that. No family that has a member of their family serving in the military should have to rely on food stamps for food. Those individuals should be earning enough to be able to care for their families because they're making the greatest sacrifice you can in this country, which is to risk your life to serve our country. So, Bonnie, what you're talking about is a very common problem. For some of our guys who are enlisted, like my little brother right now, if you're enlisted, you often don't make a lot of money. And sometimes it's hard to even make it paycheck to paycheck. And if you're lucky enough to be married and have a kid or two, it's even harder to make that paycheck. So one of the things we've got to do is make sure that military members get paid appropriately and on time. That's why last year, when the government shutdown occurred, when these members of Congress were fighting like children, I sponsored a bill and passed it to make sure the military didn't suffer a lapse in pay like other government officials, because these guys are putting their lives on the line for us, and we've got to make sure they earn enough to feed their families. Now, Bonnie, if your son is your son still in Afghanistan?
No, he's home now.
Well, I hope he's doing all right, but if he's not, if he's still struggling to make it, I hope you'll stay on the line because we have a resource booklet that we utilize to help veterans and their families figure out how to make it, even during tough times, and we want to make sure we're there to help. But the bigger issue, Bonnie, is why any person serving in our military isn't earning enough to take care of their family. That's a real shame. And that's why Congress has to appropriately pay for the salaries and the raises and the uniforms and the supplies and the health care for all of our men and women in uniform. That's something I support and I'll keep supporting. Colonel Strickland, what are your thoughts?
My thoughts are, if we're going to send young men and women into harm's way, if we're going to send them to war, we need to think about the human cost first. We need to pay them, and we need to pay them well. That includes combat pay, danger pay, and we need to make sure that their families back home are taken care of without suffering the embarrassment of food stamps. That makes me emotional.
Yeah, it's not fair.
No.
It's just not fair. Well, Bonnie, again, if your son and his family are needing help, you stay in that line because we're going to do everything we can to help them. It's just not American that our men and women in uniform wouldn't be able to take care of their kids, their families. That's heartbreaking. So, thank you, Bonnie. I want to ask you all some more questions, but if you have a question for me or you want to share a story or tell me what you think, give me some advice. I need some advice. I could use it. Please press 0 if you'd like to ask a question or tell me what you think or tell me what you think I should be doing in Washington. Just press 0 at any time. I'm going to ask you all another question, another poll question. I want to know if anyone on the call tonight or a family member or loved one has ever experienced long wait times or other problems receiving care at the VA. I know that William in Phoenix, who's on the line, has experienced that problem. He waited 4 months to see a urologist. If you or a family member or a loved one have experienced long wait times or other problems getting care at the Phoenix VA, press 1 for yes, 2 for no, and 3 if you don't know. Again, 1 for yes if you or a family member or a loved one have ever experienced long wait times or problems getting care at the VA. Press 2 if that's never been a problem for you or your family or loved ones, and press 3 if you're just not sure. While you're answering that question, I want to tell you a little bit about next week. I just want to remind all of you that there's a really important election coming up. Our primary election is 1 week from today. That's Tuesday, August 26th. If you have a ballot at home, please make sure that you mail it in by Thursday of this week. That's the last day you can mail your ballot. After that, you can carry your ballot into a polling place on Election Day. Or, if you're waiting to vote on Election Day, make sure that you know where your local polling place is, or call us, press 0 if you'd like us to help find your polling place for you. The polls are open next Tuesday from 6 a.m. to 7 p.m., and we can help you find your local polling place if you have any questions. If you need help to get to the polling place, press 0 and get on the line. We'll help take you to the polls. And I want to just take another second and ask Chuck from Scottsdale. Chuck, you're live now, and it's your turn to speak.
Okay, I just wanted to say that I tried to get, I was using the veterans for urology and couldn't get it for 6, 8, 10 months, and finally they did give me a call and sent me to a local urologist associated with that TRICARE thing, and it's worked out very well. And I just wanted to thank you for your efforts.
Well, I'm so glad you finally got to see a doctor. Now, I'm sure you know this, Chuck, but if anything else comes up, if you need a follow-up appointment or any other medical need, make sure you let the VA know that you appreciate the Tri-West relationship, and they'll get you right back into it. It is working a lot faster than the old VA was. Yeah,
it is. It was very well. So
it seems like the process is working, Chuck. Chuck?
Yes.
That's Colonel Strickland. It seems like the process is beginning to work, and we're very happy to hear that. Thank you.
You're welcome.
Well, that's good news, Chuck.
I was glad that it worked.
Well, we are too. We're sorry you had to wait so long. No veteran should have to wait more than about 2 weeks to get an appointment. In the private healthcare community, you need to see a urologist, you can call and get an appointment pretty quickly. And veterans should be able to get it even faster because of the service they've done for our country. So, Chuck, I'm glad the system's working. I'm going to take your story and back to Washington. and let folks know that the decision to contract out for this care was the right one so you can get your care quickly. I want to give the answer to our last poll question. I asked folks if they or a family member have ever experienced long wait times or delays at the VA. Half of you said yes, 50% said yes. 40% of you have not had experiences with delays or other problems, and 10% of you are unsure or don't know. So it looks like the VA system is working well for some people and not as well for other people. And this is consistent with the calls that we get at our office. Many people who are in the system say, I have a good doctor and I'm getting good care. But if you need to see a specialist or you're a young vet coming into the system, it's been very hard for some of those folks to get into the system. So thank you guys for sharing those poll results with me. That helps me share information with the VA, and it helps us guide the work we're doing. You know, if you'd like to ask a question or share a story or tell me what you think, or you have a question for Colonel Strickland or tell him what you think, feel free to press 0 at any time. We've got another caller. Susan from Phoenix, you're on the line. Are you there, Susan? Maybe not. We're going to try and find you, Susan, and as soon as we can unmute your phone, we'll get you on. You know, something I do want to share with all of you, another bit of good news about the new reform law that was just passed into law. Part of the funding of this new law allows the Phoenix VA to hire 1,000 new employees. Doctors, nurses, social workers, psychologists, psychiatrists, urologists, surgeons, because we have a huge shortage of healthcare professionals at the VA. And that's good news that we can hire 1,000 new people. The not good news is we don't have the space for 1,000 new people. So the VA reform legislation also included funding for us to buy or build a new building here in Arizona. Now, I've been urging our local VA to buy an existing building because building something takes forever. But if we buy an existing building, we can open it up within a couple months and have veterans getting care immediately. So that's our goal, is to push the VA locally to find space that's available, purchase it, and get it ready for these new hires so that veterans can get the care that they need as quickly as possible. Now, Susan, we're going to try and get you on again. Susan from Phoenix, are you there? Not quite yet. Susan, don't hang up. We're going to keep trying to get you on. For those of you who are listening, if you'd like to ask a question, just press 0 or tell me what you think at any time. There's one more provision. Oh, is Susan there? All right, Susan, you're live.
Hi, thank you so much, Congresswoman, for taking my question. I was listening to all of the reforms you're suggesting, and I'm just curious. I know we obviously need to take care of our veterans, but how are we going to be paying for all of these new reforms?
That's an important question, Susan. You know, fiscal accountability and responsibility is a big part of the work I'm doing in Washington. This new bill, the VA reform legislation, allocates about $1.5 billion that we've paid for by cutting wasteful spending in other parts of the federal system. So basically what we've done is we've gone through the budget, we've identified some things that are not very important, and we cut them. And we're putting that money into paying for the veterans' issues. We've also got another $15 billion that's being used from the general fund, which just means that we believe it's so important we're going to spend it out of our general kitty, and later we'll decide where we're going to have to cut it. But it's coming out of our current budget. So it's $16.5 billion overall. And a big part of that is for Arizona. $27 million for a new construction for a new building here in Phoenix, and funding for 1,000 new employees. In addition, we've also received funding to upgrade the entire appointment system, so it's no longer outdated and kept on pieces of paper in a drawer. It'll be electronic. We're also working to help the Department of Defense and the Veterans Affairs Office combine their computer systems so that records from a service member can be transferred easily to the VA when that service member disconnects from service and becomes a veteran. Now, Colonel Strickland can talk to you about how important this is. For years, veterans have come to the VA without any paperwork from their service while they were in active duty, and that means we're missing a whole pile of their records. So, Colonel Strickland, talk about how important it is to have this electronic record.
This is extremely important. For years, one of the biggest complaints that I had as Director of Veterans Services, Susan, when young veterans came to see me, was that they didn't know where their military records were, or that they never received a copy. And so, or if they were disabled on active duty and they received a percentage from the Department of Defense, and they were switched, and then they tried to switch over to the VA because the VA historically has paid a higher level of disability payments. They couldn't prove their injuries because they didn't have records, and so I was real. And then it just boggled my mind to realize that VA records and DoD records were not compatible, and like Congresswoman Sinema just stated, that now has been fixed, and I still advise, including my own sons who are on active duty. I have 2 sons still on active duty. I still tell them, make copies of your medical records and bring them with you, and keep them. And even though the system has gotten better, if you do that, we can process your claim for upgrades a lot faster.
Well, and this is a big issue because many veterans, when they come to the VA, maybe they have a traumatic brain injury from a roadside bomb or a rollover. Maybe they have post-traumatic stress disorder from all of their service in Afghanistan or Iraq. But if they don't have the paperwork to prove it, it takes a long time to process their claims. And in the meantime, the veteran is sitting there with no help at all.
Absolutely.
And many veterans find that their claims get denied when they first enter them. Sometimes they have to appeal 1, 2, or even 3 times before they get what's rightfully theirs. So I will say, if there are folks on the line, if there are veterans on the line who've had that problem, make sure you press 0, because my team wants to help you solve those problems. We help veterans get their claims adjudicated so they get the appropriate disability rating, the appropriate funding, and perhaps most importantly, the appropriate care that they deserve. We have another question on the line. Tom from Tempe is on the line. And if you're on the line and want to talk, just press 0 if you have a question, and we'll beep you right in. Tom, you're live.
Hi, this is Tom, and I was wondering, will there be any more clinics offered to help veterans?
Well, that's a good question, Tom. We held our first clinic, the Veterans First Clinic, in July of this year in Central Phoenix, right across the street from the VA hospital. In just one day, we served over 400 veterans and their families, and the event was a big success. It was so successful that now other cities are calling and saying, we want to do it as well. So we do expect to do another one. My hope is that in October, we're able to do another Veterans First Clinic. Our hope is to partner with the Phoenix VA and do one of these every quarter, so every 3 or 4 months to hold one of these clinics. Even after the Phoenix VA gets its problems sorted out, we still think these clinics are a good idea because it allows veterans who for some reason can't get through the system to just show up in person and get the care they need. We found this to be very successful. Colonel Strickland, what's your thought?
Well, I think that's an excellent idea, and if you can do that, Congresswoman, on a quarterly basis, it'll give the veterans community direction. A lot of veterans don't know where to go to get help, and those coupled with the annual stand down, the big one that we have here in Phoenix, would really help our veterans community. And the other thing that I want to mention to you, if you need help, don't hesitate to go over to the Arizona Department of Veterans Services. They're good people there, and they will bend over backwards to assist you. Okay.
That's very true. That's a good point. And Colonel Strickland would know. He ran it for years. Again, if you have any questions or would like to share your thoughts, please press 0. I want to share one other portion of the new VA reform bill that I'm particularly excited about. Back in 2011, when I was serving in the state Senate, I introduced a bill to grant all veterans immediate access to in-state tuition if they decided to go to a local community college or one of our 3 state universities. And when I was working to try and get this bill passed, Colonel Strickland and the department stepped up to help us. testifying in committee in support of the legislation and making sure that bill got passed. We got that bill to Governor Brewer's desk, and she signed it in the spring of 2011. And we became the first state in the country to grant immediate in-state tuition to veterans. And what that bill did was say to all service members, when you're done serving your country, come to Arizona. Use your GI Bill here. We'll give you a good quality education for low cost because we value you, we value your skills, and we want you and your family to come make a life here in Arizona. That bill is a bill I'm so proud of. And what I'm really proud to say is that we got that bill signed into law by the President of the United States just a week and a half ago, and now it applies nationally. So any veteran, wherever he or she decides to live after they get out of service, they'll get immediate in-state tuition at any community college or public university in the country because we place a high commitment to making sure veterans can get access to education, use their GI Bill, and start transferring all those great skills that they developed in the military into civilian life. I'm excited because I think this is a huge step forward in helping veterans know that they're appreciated and that they've got skills that are going to transfer right over to civilian life. So, Colonel Strickland, thank you for helping us in 2011.
I remember that.
Remember that?
Oh,
Wasn't
yeah.
it great?
Oh yeah, that was like a touchdown.
That's right. Well, we've now spread it nationally. So as of last week, it became national law. So we're really proud of that. So there's another piece of the law that I'm really proud to brag about. So in addition to reforming the VA and fixing some of the problems that exist in the system, we also are working hard to make existing programs better, to take good programs from states and spread them nationally. This in-state tuition bill doesn't cost a penny to the federal government because community colleges and universities around the country are willing to give that discounted tuition rate because they want veterans in their community. So we've got time for one more question, and I think we've got Samantha from Chandler on the line. Samantha, you're live.
Hi, thank you for taking my question. I was just wondering, what other changes do you think need to be made to the VA to address the needs of veterans?
Oh, gosh, I've got a long, long list. That's right. You know, one of the things I'm working on, I've got a whole rash of legislation that I've worked on to address the issue of military sexual assault. Unfortunately, women, some men too, but many women are facing sexual assault from their colleagues and sometimes even their superiors in the military, and they're not getting the care that they need. They need protection. They need to make sure they're not retaliated against, and they need to be able to get the care that they've earned and they deserve. So that's a big issue I'm working on. We're also concerned about the issue of, I'm sorry, say this again? Oh, that's right. We're also very concerned about female veterans, whether they're deployed within the country or internationally, that they can get their well-woman care. The women's health care in the military is not at the level it needs to be. So women who need to see a women's doctor specifically for their health issues should be able to do so in privacy, without harassment, or without having to go into unsafe situations like leaving a base in a country where it might be difficult. Yeah, exactly. So that's an issue that we're continuing to work on. I still have my bill that I'm working on for Howard and Jean Somers, and that's a bill that would allow veterans who've served in classified situations to be able to get private therapy, not group therapy, but one-on-one conversation with their doctor, with their therapist, with a psychiatrist, a psychologist, a social worker, so they can talk about the experiences they've had in the military. You know, if you served in a classified service, you legally can't talk about what you've done or what you saw or what you experienced. Only in a private setting are you allowed to talk about it. And so many of these veterans find themselves in situations where they have pain and trauma, but they can't even share it to begin healing. We also need to do a lot of work to advance mental health services in the VA. And that's why our office established a working group with mental health providers in the community and the Phoenix VA and veteran service organizations. This working group meets every 2 weeks. We're establishing a long-term coalition, and we're teaching the VA to partner with community organizations to make sure that veterans who come home from warfare get the help that they need. And you know, Samantha, this is a real issue in particular for our younger vets who are coming home from Iraq and Afghanistan. They've experienced a different kind of war than some of our previous veterans. Warfare is different today than it was 20 or 30 years ago or 50 years ago, and these guys have special needs. So we want to make sure that our VA can meet their needs in particular. So that's something we're continuing to work on. Colonel Strickland, what are some of your thoughts?
Some of my thoughts echo exactly what you just stated, Congresswoman, but I'd also like to take it a little bit further. I think that we need to mention the service for our rural veterans in our small towns, our Native American veterans, and the need for the VA to do a little bit better job in terms of telemedicine to treat post-traumatic stress and physical illnesses resulting from their service. So we need to continue to, here in Arizona, we're very fortunate that we have 3 VA medical centers and about 18 clinics, but we also need more state veterans homes. We're very happy that we're going to break ground here in 2 weeks on a couple of state veteran cemeteries, but we need to address the needs of our young veterans in the rural areas who need jobs, who need treatment for post-traumatic stress. I don't think that the federal VA does a good enough job in that area.
I think that's a really good point. I agree 100%. In particular, on the issue regarding rural veterans, one of the things that I'm particularly happy about in the new law that just was signed by President Obama, the new law says that if a veteran lives 40 miles from a VA facility of any kind, that they can go get private health care in their neighborhoods or in their communities. So if you're a vet living in Yuma or up on one of our nation reservations, it can be really difficult to get care from the VA. You have to drive for hours and hours. And this law now says that those veterans can get care in their local communities from the doctors they already know and trust. And the VA will cover the cost of that care. That's important because it means those rural vets will get to see someone in their community they know and trust. Go ahead.
Also, Congresswoman, I really think that we need to continue to fund and encourage in Congress, and I'd like for you to kind of keep this in mind. There was an MOU signed between Indian Health Service and the VA to take care of veterans on the reservations, and that's a very good program. I know for a fact that it's working on the Navajo Reservation at Fort Defiance, where the Native veteran can go to the IHS doctor, and the IHS bills the VA.
That's great.
Instead of duplicating bricks and mortar buildings.
Well, that makes a lot of sense because that veteran already knows the folks at IHS, their family goes there, they have a trusting relationship, and most importantly, it's accessible.
Exactly.
Yeah, that makes a lot of sense. Well, what we've been trying to do with this legislation, and we'll keep fighting for it, is reduce duplication and waste and try to find efficiencies. But above all, it has to be about putting veterans first. So, like this evening when William told us it took him 4 months to see a urologist, and we heard from Charles, who said it took him 10 months. Or Chuck, sorry. I'm giving you guys nicknames this evening. No veteran should have to wait longer than 2 weeks to see a doctor, and you shouldn't have to wait more than a month to see a specialist. And what we're looking for is to figure out how to make this work for veterans, because the number one priority can't be cost. The number one priority can't be about reducing paperwork. The number one priority has to be about putting veterans first. I think our country owes no less to the men and women who've served so bravely. So we finished our time for this evening, and I want to say thank you to everyone who's on the call this evening, and I want to say in particular thanks to my friend, I almost called you Lieutenant Colonel. That was not right. I almost demoted him. I want to say thanks to my friend, Colonel Joey Strickland, for being here this evening, for all the work you've done over the years and what you continue to do for veterans. And to all the men and women who are on the phone tonight, if you're a veteran or have a loved one who's a veteran, thank you. Thank you for your service to our country. And please know that we are here to be helpful to you. Colonel, any closing words?
Congresswoman Sinema, I know that you have a young brother that's in the Navy.
That's right.
And I have a pen that says Navy. I'd like to present it to you.
Oh, wonderful. Thank you.
I want to thank you for his service and for your other brother's service in the Marine Corps.
Thank you.
I wish you'd had a brother that served in the Army, but we'll excuse that.
Well, my grandpa and my stepdad served in the Army. Will that count?
Yes, ma'am.
All right. Well, that's 2 out of 4. Army's winning.
That's good. But I was honored to serve our veterans over in 2 states over an 18-year period, and I look forward to working with Congresswoman Sinema. I think she's a great veteran supporter, and guys and gals out there, I want to keep her around. We need her. So thank you, Congresswoman.
Well, thank you. And thanks so much to everyone for listening tonight. Have a wonderful evening. Good night.